Some people don't just collect things, they feel they cannot let go. To others, it looks like clutter, but to them, it means something more.
But this one is my mom buying me, when she stay with me in Malaysia. I want to keep some memory. Okay, even it's useless, I will also keep it.
What's this?
It's getting worse. You said it would clean up. I'm cleaning. Just need some time. Don't rush me. What's this? Why are you keeping this? It's useless. Don't touch it. Don't throw it. It's meaningful for me, and it might be used, you know? I can use for someday. Don't touch it. This isn't normal. You're just making excuse. That's lazy.
What we see as a mess may be something much deeper for them. This is not laziness. This is mental disorder.
According to the classification system of DSM-5, hoarding disorder is formally categorized under the broader group of obsessive-compulsive and related disorder. This category does not refer to a single disorder, but rather a spectrum of conditions that share similar underlying features in terms of repetitive thoughts, urges, and behaviors. Hoarding disorder is defined as a persistent difficult discarding possessions, regardless of their actual value. In simple terms, individuals find it extremely difficult to let the things go. This is mainly categorized by three key features: a strong difficulty discarding possessions, a perceived need to save items, and the accumulation of objects over time. As these items build up, they begin to clutter and compromise the intended use of living space, such as making rooms unusable. This difficulty is driven by the distress associated with discarding, and it often leads to significant impairment in daily functioning. Importantly, these items are not just objects to the individual, but often carry strong emotion or personal meaning. According to the DSM-5, although the exact prevalence of hoarding disorder is not explicitly specified, it is recognized as a clinically significant condition that extends across population and cultures. Based on current research, hoarding disorder is estimated to affect approximately percentage 2 to 6 of general population, indicating that it is not a rare condition. In terms of distribution, the disorder tends to become more common and severe with increasing age, and it is often more noticeable in older adults. Students also suggest that it affects male and female at relatively similar rates. Overall, this showing that hoarding disorder is a widespread mental health issue that can have a significant impact on individuals' daily functioning. So, what does this disorder actually look like in daily life? The first one is long-lasting discarding difficulties. Referred to the DSM-5, the difficulty discarding possessions result in the accumulation of possessions that congest and occlude activity living area and substantially compromise their intended use. Second one, space congestion and mess. Hoarding disorder is very different from normal collecting. People with this condition don't just keep things for fun. They keep so many items that their homes become extremely cluttered. In some cases, The space is so crowded that they can't even use it properly anymore, like not being able to sleep on the bed or cooking in the kitchen. Third one, damage function. This behavior leads to observe psychological pain or impair the ability to socialize, professional, and maintain a safe environment. The first one, biological factors, which means genetic and brain-based. At the deeper level, hoarding disorder is linked to biological factors. Family history. It tends to run in families, especially with obsessive-compulsive related disorders. Risk level. First-degree relatives of people with the OCD are about twice as likely to develop it. And the risk can be much higher if it starts earlier in life. Brain function. It is also related to how certain brain areas work, especially those involved in decision-making and emotional control. Second one, psychological and cognitive factors. These are the main triggers that drive the behavior. Decision difficulty, fear of the making wrong choice leads them to keep everything. Strong need to save. People feel a powerful urge to keep items. Distress when discarding, throwing things away causes real emotional discomfort. Disorder value, they often overtiming the importance of items, no matter their actual value. Environmental factors, there are external triggers that can start or worsen the condition. Childhood experience, trauma or stressful events in early life can increase the risk. Early life factors, things like birth complications or prenatal risk may also play a role. Sudden triggers. In some cases, symptoms can appear or worsen after certain life events or physical conditions. About the intervention. According to the DSM-5, while hoarding disorder is clearly defined as a clinical condition, the manual itself does not provide specific treatment guidelines. However, based on clinical practice, several interventions are commonly used to manage the condition. One of the most effective approaches is cognitive behavioral therapy, CBT, which helps individuals challenge their beliefs about processes, reduce emotional attachment to items, and gradually build their ability to discard them. For example, in a therapy session, a therapist might gently guide a person to sort through a small number of items, asking questions like, "Do you really need this?" or "What would happen if you let this go?" instead of forcing them to throw things away. The process is gradual, helping them tolerate the discomfortable and making decisions step by step. In some cases, medications such as selective serotonin reuptake inhibitors, SSRIs, may be used to reduce associated anxiety or distress. Additionally, practical interventions such as skills training in organization and decision-making, as well as support from family members, can play an important role in improving daily functioning. Overall, effective interventions focuses not only on reducing clutter, but also on addressing the underlying emotional and cognitive difficulties associated with the disorder. Advocate message. Hoarding disorder is often misunderstood, so it is important to address some common misconceptions. First, it is not simply about being lazy or messy. According to the DSM-5, it is a psychological condition involving a persistent difficulty discarding items and intense distress when doing so. Second, the distressing experience is real and significant. For individuals with hoarding disorder, letting go of possessions can feel overwhelming, which is why they need understanding rather than judgment. Third, insight plays a crucial role. Many individuals may not fully recognize their behavior as problematic, which makes supportive guidance and professional evaluation more important than forced clean-ups. The lower the level of insight, the more likely someone is to deny the problem or resist support. Over time, this can make the situation worse. Understanding insight helps us respond with more empathy and be more effective.
It's okay. I understand you now. I know you're not lazy. Don't worry. I will accompany you.